Hello, I'm Dr. Michael Miller at Informed Diagnostics. I'm here today to instruct you on how to prepare the highest quality bone marrow biopsy specimens, allowing us to give you a timely, accurate diagnosis. Informed Diagnostics is your partner when caring for your patients who are undergoing bone marrow biopsy procedures. The moment the specimen collection starts, the laboratory becomes an intricate partner with the provider performing the procedures. Our goal is to help you prepare the highest quality specimen. One of the ways we guarantee this is through our bone marrow biopsy shipper kit. This kit contains everything you need to prepare and ship us high-quality bone marrow biopsy specimens. Today, we will show you how to use the contents of this kit to help you prepare quality specimens.
To properly prepare your bone marrow biopsy specimen, you should make sure your bone marrow biopsy shipper kit contains the following: 2 formalin jars, 2 microscope slide holders, 10 microscope slides, 2 purple top EDTA tubes, 2 green top sodium heparin tubes, 1 labeling pencil, 1 page of 4 peel-off labels, 1 biohazard specimen bag, 1 refrigerant pack, 1 thermal pouch, 1 requisition form, and 1 laboratory pack for shipping. And if any of these items are missing from your shipper kit, please contact Informed Diagnostics. Before preparing your specimens, please ensure you keep any open formalin jars at least 2 feet away from any slides being prepared. Formalin fumes can damage slide specimens. The first sample we will prepare is the bone marrow core biopsy. This will require a single microscope slide, a formalin jar, and your core biopsy specimen. Using a pair of forceps, touch the core with the slide 3 or 4 times. Move the slides away from the formalin jar before opening. When finished, place the core biopsy specimen in the formalin jar and screw the lid on tightly. Make sure you produce 2 to 3 high-quality specimen slides from the sample. Remember, quality is better than quantity. Label all your slides with at least 2 unique patient identifiers. To create bone marrow aspirate smears, you will need 2 aspirate syringes. For the first syringe, you will need to collect at least 2 to 3 milliliters of aspirate specimen. This material will be used to produce 2 to 3 high-quality smears. Carefully use the syringe to place the bone marrow aspirate in the Petri dish. Use a pipette to carefully capture spicules, which will be used to create aspirate smears. To properly prepare the aspirate smear, you will need 2 glass slides. Take the first slide with the aspirate material and lay it on a flat surface or hold it level. Then, take the second slide and lower it carefully over the first slide until they are touching. The slide is gently pulled back, creating the smear. A proper smear should look oval-shaped and show detail without being too thick. Again, label the smear with 2 unique patient identifiers. Ensure the smears are completely dry before returning them to the slide container. Again, you will want to produce 2 to 3 high-quality smears. If a substantial amount of aspirate material remains, do not discard the Petri dish, as you may need it to prepare a later specimen. You will also need 1 purple top EDTA tube and 1 green top sodium heparin tube from the bone marrow biopsy shipper kit. First, place 2 to 3 milliliters of aspirate material in the purple top EDTA tube. Afterwards, immediately cap the tube. Invert the tube 8 to 10 times to prevent the aspirate material from clotting. Repeat the process for the green-topped heparin tube. Again, make sure you use 2 to 3 milliliters of aspirate material for each tube. Make sure to properly invert the contents of the tube 8 to 10 times before shipping. Make sure both vials are properly labeled with at least 2 unique patient identifiers. When done, place the tubes back in the provided foam container. For the bone marrow clot specimen, you will need the remaining formalin jar from the bone marrow biopsy shipper kit. Carefully unscrew the lid of the formalin jar, making sure to keep it away from any prepared smears. By this point, any remaining material in the petri dish or syringe should have formed a clot. This step can also be done with any clotted material remaining in one of the aspirate syringes. Take a pipette and begin collecting the clotted material. Place the clotted aspirate material in the open formalin jar. Again, remember to secure the lid of the jar tightly to prevent leakage while the specimen is in transit. For these samples, you will use the remaining purple-topped and green-topped tubes in your bone marrow biopsy shipper kit. The process of creating peripheral blood smears is different than creating aspirate smears. To begin preparing these specimens, you will need peripheral blood that has been collected in a purple-topped EDTA tube and 2 clean microscope slides. First, place a drop of well-mixed blood near the frosted area of the slide. Bring the second slide up until it comes in contact with the blood, and put it back down the length of the slide, creating the smear. An ideal peripheral blood smear will have a distinct feathering at the edge of the smear. Again, the slide is labeled with 2 unique patient identifiers. Ensure the slides are fully dry. Prepare 2 to 3 high-quality peripheral smears using this technique. Once your smears are completely dried, place them into the slide container. Peripheral blood tubes should be placed into the foam shipping container after the smears are made.
By now, you should have a better understanding of how to submit a high-quality bone marrow biopsy specimen. When we receive high-quality specimens from you, your patients get definitive results from us. Remember, every patient deserves the right answer.
For more information, visit us online at informdx.com or call our hematology and oncology services at 855-856-0656.